Hello friends, welcome back to the channel. Like, share, subscribe and don't forget to press the bell icon. Human metapneumovirus HMPV is a newly identified pathogen causing acute respiratory tract infections in young infants worldwide. Since the initial documents of HMPV infections in China in 2003, Chinese scientists have made lots of effort to prevent and control this disease, including developing diagnostic methods, vaccines, and antiviral agents against HMPV, as well as conducting epidemiological investigation. However, effective vaccines or spiral antiviral agents against HMPV are not the developing early diagnostic method and known its epidemiological characteristics with be beneficial for HMPV control. Epidemiological characteristics of HMPV in China and its available detection methods, which will be beneficial to increase the public awareness and disease control in the future. The HMPV molecular diagnostics approaches are RT-PCR. Their operational time is 3 to 5 hours. The limit of detections have 1000 copies per reaction and the experimental cost is low as the RT-PCR has been widely used for performing epidemiological investigation of HMPV, while which requires complex instruments and trained workers. Now, talking about the second method, RT-qPCR. Their operational time is from 1 to 3 hours. Limit of detections has 10 to 100 copies per reaction as their experimental cost is low because RT-qPCR has been widely amplified in HMPV monitoring in clinical samples. Talking about the third one, LAMP. Their operational time is somehow 1.5 hours because the limit of detection has less than 10 copies per reaction and the experimental cost is also high because their advantages include high sensitivity and specificity, rapid diagnostics with simple reaction procedure and constant temperature. Disadvantages include high requirement of primers, high false positive rates and high cost. Now talking about the fourth HMPV diagnostic approaches, that is RAA. Their operational time is between 15 to 30 minutes as the limit of detection has 100 copies per reaction and the experimental cost is also high because their advantages includes high sensitivity and specificity and rapid diagnostics of virus infections. Their disadvantages have high cost and high positive rates. Now the RT-RPA combined with CRISPR Cas 12A. Their operational time is less than 30 minutes. Limit of detection is also less than 700 copies per reaction. Their experimental cost is also high because advantages includes high sensitivity and specificity and rapid diagnostics of virus infections. Disadvantages have high cost and high positive rates. Now, the MNGS, their operational time is 5 to 10 days. Limit of detection and experimental cost is also high because advantages include high sensitivity and specificity and rapid diagnostics of unknown pathogens. Disadvantages also include high cost and time consuming. Now, the last one, virus isolation. Their operational time 3 to 4 days or more time because experimental cost is also high. The advantage is the gold standard for pathogen detection. Disadvantages high cost and time consuming and low isolation rate and requires complex instrument and trained workers. RAA is a newly invented thermostatic amplification method which can be performed with easy operation processes, simple equipments and high amplification efficacies and has been widely applied in field diagnosis of different pathogens. Used the conservation region of the HMPV gene to design primers for investigating the RAA method. The LOD of the established method was 100 copies, which was significantly lower than the commercial RT-qPCR method. Moreover, the RT-RAA reaction system was set 39 degrees Celsius for 15 minutes, which needed less running time compared with the RT-qPCR method. HMPV is still one of the major infectious viruses that cause acute respiratory tract infections today, and it has been continuously posing huge economical burden on the World Public Health Organization. Despite numerous efforts focused on developed diagnostic technologies for HMPV detection, epidemiological surveys, vaccines, and other antiviral agents against this pathogen, there are currently no effective vaccines or medications against HMPV. In light of this, rapid identification of positive cases and comprehensive investigation of HMPV epidemiological features are essential to prevent HMPV outbreaks and lessen their harmful effects. There are currently many nucleic acid based technologies for molecular HMPV detection available, which significantly lessen the challenge of HMPV diagnostics in various diagnostics content. Among these, RT-PCR has been extensively used for pathogen detections, while the method is not appropriate for early HMPV diagnostics because of its low sensitivity. The RT-qPCR methods has a high sensitivity than the traditional RT-PCR and requires less operational time and fewer equipments. Thus, RT-qPCR has been widely used for the timely molecular detection of HMPV. Additionally, a number of multiple RT-qPCR techniques has been developed and are used to simultaneously detect different pathogens including HMPV in light of the relatively low prevalence of the HMPV compared to other acute respiratory tract infections related viruses and the frequent occurrence of co-infections compared with the single RT-qPCR. Multiple RT-qPCR methods are less costly and less time consuming. Moreover, visual detection method such as LAMP, RAA, and CRISPR or Cas12a combined with RPA has also been developed for HMPV detection. These detections method exhibit high sensitivity and do not require complex or comprehensive equipments, making them alternative approaches for HMPV detection in certain special locations, such as field inspections at home or custom centers. Furthermore, MNGS is an emerging molecular detection technology that can directly identify a large number of pathogenic microorganisms in clinical samples as well as amplify the complete genome of causative agent. While MNGS is time consuming and more expensive compared to other molecular detection technologies, it may not be suitable for severely infected patients. Thus, each molecular detections methods has its own advantages and disadvantages. These characteristics should be fully considered in the clinical application. In terms of the epidemiological characteristics of HMPV in China, the document obtained from the database showed that HMPV has been widely prevalent in different regions of China. Although the prevalence of HMPV is relatively lower than some ARTIs related viruses such as HRV and RSV, the threats of its poses to public health over all the pooled molecular prevalence of HMPV was 4.70% as supported by nationwide prospective surveillances surveyed conducted in China, which showed a 4.1% HMPV positive rate among eligible patients with acute respiratory infection from 2009 to 2019. Notably, the prevalence of HMPV varied significantly by geographic regions. This variation may be attributed to the differences in molecular detection method, sampling sizes, patient ages, and other factors, all of which requires further investigation. The result of additional analysis revealed a significant association between the occurrence of HMPV infection and sampling seasons as well as patient's age. In terms of sampling seasons, patients with acute respiratory tract infections in spring had nearly 9 times the risk of HMPV infections compared to those in summer and autumn. As for age, the prevalence of HMPV among patients with acute respiratory tract infections was significantly higher in young children compared to older children. Young children are at a high risk of HMPV infection in spring, while the threats of these pathogens to elderly patients in other season should not be neglected. However, the gender and disease severity had limited effect on the rates of HMPV infections among patients in China. Due to the significant genetic variations of HMPV strains, they can be divided into multiple genotypes. It is important that the genotypes or lineage of HMPV may vary from one region to another. The epidemiological characteristics of HMPV in China were not comprehensively analyzed, and several factors contributed to this. Firstly, not cover all, and secondly, although 56 representatives were included in assessed the prevalence of HMPV in China. Essential background information such as sampling season and disease severity level, load to the tested sample, and other risk factor that is not included or provided. Thirdly, the most of HMPV epidemiological has been reported in Guangdong, Lingzhou, and Beijing. The epidemiological characteristics of HMPV in other regions or provinces were relatively limited and even in deficiency. Fourthly, this review summarized the types and proportions of different HMPV lineages in the investigated regions. However, most of the papers did not provide essential information on viral load, clinical signs, or disease severity of patients infected with different HMPV lineage. These hinder a comprehensive evaluation of epidemiological feature of HMPV in China. Therefore, it is suggested that the future HMPV epidemiological should overcome this potential drawback. A variety of molecular diagnostic methods have been developed for detecting HMPV in China. RT-PCR, RT-qPCR, and multiple RT-qPCR are widely used approach for clinical HMPV detections. As alternative options, other visual detection methods should be implemented in clinical testings as early with the consideration of lower cost, high sensitivity, and high convenience. The relatively low prevalence of HMPV infections among patients with acute respiratory tract infections in China. The prevalence was significantly associated with sampling season and patient's age. Moreover, multiple HMPV lineages are prevalent in China with high proportions of A to B, B1 and B2 lineages. It is crucial to continue monitoring and epidemiological spread and genetic evolution characteristics of this pathogen in China.